Hello, I'm Hannah Donner with the Collaborative on Health and the Environment. She enjoys bringing you the latest environmental health science through our partnerships, calls, webinars, science serves, publications, and social media. I would like to welcome everyone to today's CHE Partnership webinar call titled Safer Green Cleaning, Sanitizing and Disinfecting in Childcare Facilities and Schools During the COVID-19 Pandemic. Our moderator today is Karen Wang, Director of CHE and founder of Because Health, an environmental health education campaign for millennials. We will leave time following the presentation for a brief Q&A session. You may type in questions through the Q&A feature available on the menu bar at the top of your window at any point during the presentation. After the presentations, our moderator will read out questions for our speakers to respond to. We'll get to as many comments and questions as we can during the Q&A period. For those of you who called in on the phone, we've posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone on the webinar right now is muted with the exception of our speakers. This webinar is scheduled to last for 45 minutes or an hour and is being recorded for our call and webinar archives. Our first speaker today is Stephanie Holm. She is co-director of the Western States Pediatric Environmental Health Specialty Unit. Dr. Holm received her medical degree in 2011 from the University of Pittsburgh. She is board certified in both pediatrics and occupational environmental medicine. She also completed a year of pediatric pulmonary training at Oakland before leaving to further pursue her interests in pediatric research and pediatric environmental medicine. As part of her work with the Region 9 PACU, she reviewed literature relevant to disinfectant use and toxicities in early care and education environments. Dr. Holm completed an MPH in epidemiology at UC Berkeley in 2017 and is currently pursuing a PhD in epidemiology while continuing her research activities. Our second speaker today is Dr. Vicki Leonard. She has been working as a childcare health consultant for the past 7 years, first as a nurse at the California Childcare Health Program, UCSF School of Nursing, then at UCSF Institute for Health and Aging. Dr. Leonard was the principal author of the California Department of Education Child Development Division's Preschool Learning Foundation in Health and Physical Development. She worked with Dr. Asa Bradman on a Department of Pesticide Regulation funded survey of pesticide use in California child care centers and was the principal investigator on Toolkit, Green Cleaning, Sanitizing, and Disinfecting, a toolkit for early care and education. She has presented to audiences of child care providers, directors, EPA staff, and administrators on health hazards associated with environmental exposures, as well as integrative pest management and green cleaning, sanitizing, and disinfecting. Vicki heads up the PACU Environmental Health and Early Child Care and Education Project. Our final speaker today is Dr. Karen Wang, CHE's director and founder of Because Health, an environmental health education campaign for millennials. As director, Karen has strengthened CHE's programming to include sharing the latest science on how plastic pollution and climate change impact human health. She's also deeply committed and passionate about sharing science and education on the health effects of toxics and effective toxic reduction. She brings deep knowledge and experience in statistics, research methods, and data analysis. She particularly enjoys communicating scientific research to non-technical audiences. Karen completed her PhD in strategic management, a quantitative social science discipline grounded in applied economics and social psychology at the Foster School of Business at the University of Washington. Karen also holds a Master of Science in Earth Systems and Bachelor's in Economics from Stanford University. With that, I'll pass it on to our first speaker. Vicki, would you like to take the mic?
Sure, thanks, Hannah.
Sure.
So I'm going to provide some context, an introduction to the topic before Stephanie steps in. And the first thing I'd just like to address is why should we be concerned about environmental health and early care and education in schools? The first reason is that there are many children who are in these facilities. There are 8 million kids in child care centers in the United States, and some kids spend up to 12,000 hours in a child care facility between birth and age 5 when they go to school. That's more hours than kids spend in K through 12 education. There are also 1 million child care providers who work in these centers in the United States, and this doesn't count the family child care providers who are also using a lot of products like cleaning disinfectants. And half of these women who are working in childcare are childbearing age. So when they become pregnant, there are special considerations for them as well. Many of the toxicants found in childcare facilities are not addressed in any state childcare health and safety regulations. And there's no agency at the state or federal level that's charged with ensuring children's health and safety in and around schools and childcare facilities. And we don't have any way to systematically collect data on environmental exposures in these facilities. And in fact, teachers actually have more protection in childcare and school facilities than children do. They're protected by their unions and they're protected by the Occupational Safety and Health Administration. So parents and concerned nonprofit people need to think about these things in order to protect children in these facilities. We should also be concerned because many people think that adults and children are exposed to and affected by toxic chemicals in the same way, and this is not the case. Children have higher exposures to toxicants in the environment because of their physiology and their developmental state. You know, they're on the floor more, they put things in their mouths, they have higher surface body area. So there are many reasons why they have high exposures, and they're also more vulnerable to the effects of these exposures to toxicants than adults. Their systems are developing, you know, the timing of exposures during sort of these exquisitely choreographed developmental processes, particularly in their brain, make them much more vulnerable to these exposures than adults who don't have these developmental processes going on. So products used to clean, sanitize, and disinfect childcare facilities and schools are a good example of the pervasive and unregulated use of toxic chemicals that put the health of our children at risk. A green cleaning, sanitizing, and disinfecting program is really a great way to reduce everyone's exposure to toxic chemicals. So I would encourage people to use the pandemic as an opportunity to think about these issues and implement a program that can last beyond the pandemic and protect everybody. So I'm first going to talk about the differences between cleaning, sanitizing, and disinfecting because many people confuse these. Many people refer to disinfecting as cleaning, and many people think of disinfecting as cleaning, but it's not. Cleaning uses a detergent and water to physically remove dirt, grime, and germs from surfaces. It doesn't necessarily kill germs, but in this particular pandemic, the virus SARS-CoV-2 has an outer lipid layer that is dissolved by soap, and the virus falls apart and gets washed down the drain. So in the case of this particular virus, cleaning actually does work to kill the virus. Cleaning also removes molds and allergens that can trigger asthma symptoms, and it's been found to remove as much as 99% of germs of all kinds when microfiber cleaning tools are used. So things like microfiber mops or cleaning cloths are very effective at removing both dirt and germs.
Vicki, if you could hold on for a second, the slides that you're advancing are not working. So Hannah is gonna take over sharing the slides.
Okay.
Hannah, can you do that?
So should I stop sharing my screen?
Hannah will take over.
Yeah, you can just leave yours up and I'm going to go ahead and share and we'll go ahead and get to this spot here.
For the slides that have been missed, you can download them on our website. And maybe we can just slowly flip through them, Hannah, so they can see.
What slide were we on, Vicki? Do you remember?
7. Sanitizing.
Sanitizing, there we are.
Yeah, okay. Okay, so sanitizing is most often used on food contact surfaces, primarily because the disinfectants often are too toxic to use on surfaces where food is involved. So sanitizing reduces the number of germs on a hard surface or object to a safer level. It's at least a 99% 99.9% reduction. And for food surfaces, the level is a 99.999% reduction within 30 seconds. So note that this is a reduction. So if you start with a really dirty surface, you're going to end up with more microorganisms at the end than if you were disinfecting. Sanitizing products should state on their label the surfaces they're intended to be used on. So make sure if you're using a product to disinfect food contact surfaces and mouthed toys and pacifiers that the sanitizer has both a registration number and a food contact surface designation. Okay, next one. Okay, so disinfecting inactivates 99.999% of germs on surfaces or objects if it's allowed to sit visibly wet. This is called dwell on the surface for the recommended amount of dwell time. This is really critically important. Many people spray a disinfectant on a surface and then wipe it off. Many people don't even know what the dwell time is. So it's critically important when you're disinfecting that you know what the product that you're using, what the dwell time is for that product. So in childcare, we disinfect things like changing tables, bathroom sinks, and high-risk areas that collect lots of germs. So this is very important during the pandemic, is to sit down and think about areas where lots of people touch surfaces and to then use a disinfectant and a microfiber cloth frequently on those high-touch surfaces. One of the reasons you want to, besides allowing the disinfectant to do its job and kill the germs, if you don't allow a disinfectant to sit on the surface, it may lead to the creation of superbugs. It's sort of like taking an antibiotic that's supposed to be taken for 10 days for 5 days. So you kill off the weaker germs and you allow the more virulent or stronger germs to survive. So this isn't a good thing. Okay, next slide. So how do we know what process to use? For childcare, and this is probably helpful for schools as well, to think about the surfaces that you need to clean, sanitize, and disinfect. There's a wonderful publication called Caring for Our Children. And these are the National Health and Safety Performance Standards for early care and education. They were developed by the American Academy of Pediatrics and the American Public Health Association. And in this very large book, there's an Appendix K, and it's called Guide for Cleaning, Sanitizing, and Disinfecting. So this is just a snapshot of the beginning of Appendix K, but if you want to know the full list of all the surfaces that you need to do what to, then go to the full Appendix K, and you can use that as a guide. It's very helpful. And for people in childcare, if you have other health and safety questions, Caring for Our Children is a really wonderful resource. It's available online. You just Google it, and you can download the whole thing as a PDF. Okay, next slide. So some people there are some products that disinfect and clean. They state they disinfect and clean, and people want to use these products everywhere. So why should you not do that? Well, if you look at the fine print on these products, they definitely don't want you to use the product on a really dirty surface and consider it disinfected. Even a disinfectant / cleaner combined product won't disinfect a really dirty surface. So it's always a good idea to clean the surface before you disinfect. Germs can hide under dirt and grime so that they escape the effects of the disinfectants. And some disinfectants, particularly bleach, are not effective in the presence of dirt. Any organic material on a surface will cause bleach to be less effective as a disinfectant. Also, disinfectants by nature are toxic to live organisms. So they're not something you want to use when you don't have to. even the most, the safest disinfectants we can come up with are still products that are used to kill microorganisms, and they're not safe as such. And they're also more expensive than products used to just clean. Again, and I think I mentioned this earlier, but overusing antimicrobial products is also, it's sort of like overusing antibiotics. We've got a huge problem in this country with superbugs, and we don't want to disinfect things that don't need to be in disinfect and contribute to that problem. And then finally, never use disinfecting products or disinfecting wipes on bodies or hands, ever, never. They're not meant for human application, they're for surfaces. Okay, next slide. So some key points. When you see cleaning products on the grocery store shelves and they use words like natural, non-toxic, and green, these words are unregulated by the government and they don't really mean anything. Researchers find that some products that have these names on them have as many toxic chemicals as conventional cleaning products. They don't have to list the ingredients on the label, so you can't look at the ingredients to see if they're safer. And the manufacturers don't have to prove that they're safe before they market them. So all these gaps in information on product labels make it very difficult for consumers to make wise choices when purchasing cleaning and sanitizing and disinfecting products. Next slide. So the only way to know which cleaning products are safer is to buy products that are certified as safer for human health and the environment by an independent third-party agency. Next slide. So there are 3 of these that we point to usually. The first one is Green Seal, which is an independent nonprofit that's been around for a long time, and you can go into their website and do a search for cleaning products. Many of them are available primarily by distributors. They're not retail products as often as some of the others. Eco Logo, this is the same. You can go to their website and find cleaning products. You can find all kinds of cleaning products, so window cleaning, floor cleaning. For both Eco Logo and Green Seal, they have different categories. And then Design for the Environment is the EPA's program for certifying safer products. And these products tend to be available in retail stores. And you can look for this Safer Choice logo on the label of cleaning products. And when you see it, you know that it's been certified as safer by the EPA. The only agency that can certify disinfectants as safer is the EPA's Design for the Environment Pilot Disinfectant Project. The web addresses for all these programs are listed in the resources. Next slide. And I just want to emphasize that surfaces, first of all, are only disinfected until someone comes along and touches, coughs, or sneezes on them. And then they're no longer disinfected. So you can't disinfect something and then just assume that, for the rest of the day it's taken care of. For that reason, you have to remember that if you touch a surface that's contaminated with the COVID-19 virus, you won't get sick if A, you don't touch your face, and B, you wash your hands for 20 seconds with soap and water. Hand sanitizer is acceptable if hand washing is not possible, but it's not as effective, especially if hands are dirty. It's like disinfecting a dirty surface. So remembering that COVID is primarily spread by inhaling droplets in the air, that is an important thing to remember. No matter how much you disinfect, you're not going to prevent inhalation of the virus. And then again, as I talked about before, it's encased in a lipid envelope. So soap and water dissolve the virus surface, it'll fall apart and go down the drain. Next slide. So the CDC recommends for indoor areas that you clean and disinfect frequently touched, and that's frequently touched by many people, not one person. Hard surfaces and objects often. Soft and porous materials like carpets, rugs, or textiles the best way to deal with them is to launder them. Some disinfectants do work on porous surfaces, and you have to look at the EPA's list and for products that can be used on these surfaces. It's actually better, whatever of these materials that you can put away for the duration of the pandemic is what makes more sense than trying to disinfect them. Okay. In outdoor areas, you have to maintain existing cleaning practices. And if you don't have any practices, it's a good time to sit down and talk about how you clean the playground surfaces that children play on. The virus does die in hours to days in typical indoor and outdoor environments, especially when the temperatures are warmer and there's higher humidity and sunlight. The high-touch surfaces should be cleaned, but not disinfected routinely outside. And then you should not disinfect wooden surfaces or ground covers. It's not recommended. And very importantly, rather than concentrating on disinfecting outdoor surfaces, teach children not to touch their faces and to wash their hands with soap and water after they come in from outdoor play. They should always have access to soap and water when they come in. Okay, next one. You need to store and use disinfectants in a responsible manner according to the label. Don't mix them. Keep them out of the reach of children. And remember that large containers of hand sanitizers are flammable and should be stored as such. I talked about food contact sanitizers. If your facility's been unoccupied for 7 days or more, it only needs normal routine cleaning to reopen. The virus doesn't last longer than 7 days. Okay. These are just a couple of resources. The Green Cleaning, Sanitizing, and Disinfecting Toolkit is quite extensive. There are 12 fact sheets for providers and families, and a checklist and a whole description on how to start a green cleaning program, and our infographic on safer disinfectant. These are both available on the Western States PACED website. And that's it.
Great, thank you so much, Vicki. While we're getting ready for Dr. Holm to pull up her slides, I'd remind you all to please put in your questions in the Q&A feature at the bottom of the Zoom box, and we'll go on to Stephanie as soon as she's able to share her slides. Dr. Holm, are you able to share your slides, or would you like me to pull them up?
I am working on getting them. Give me 1 second, and then if I'm not able to do it, then I'll let you do them. Hello, everybody, and thank you, Vicki, for that nice contextualization. That was really great. Hannah, why don't I let you go ahead and pull them up? I'm having a funny little glitch right now.
All right, sounds good.
All right, so to just bounce off of what my colleague Vicki was saying, really the focus should be that you should be planning to clean everywhere and then disinfect high touch surfaces or those that you're required to by regulation. So I think one of the things that's important to remember is that generally the regulations that cover cleaning and disinfecting at schools and at childcare centers are at the state level, and so we can't possibly summarize all of those in a way that would be meaningful for all of you who are probably all around the country, but you should know what those are and know your local regulations. And what we want to help you do is be able to make the safest choices within what those regulations are. So, if you are required to sanitize or disinfect a surface, you should absolutely be doing that. For ones that you're not required to sanitize or disinfect, you should focus on cleaning, and you should choose the safest products available to you within what your regulations allow. All right, slide, Hannah. This is just some acknowledgement. Some of my colleagues and I worked a few years ago on a large review paper that was looking at the use of disinfectants in early care and education settings. Certainly, if you're interested in reading a scientific review paper, you can feel free to take a peek at that. I'm the first author on it, and it goes over evidence both for efficacy and safety of disinfectants. So thanks to my colleagues for everybody's work on that. And I will note that my work at the PACU is partially funded by the EPA and ATSDR, but that my presentation represents my own work and I don't speak on behalf of any agencies. All right. So why do we worry about cleaning and disinfecting products? There's a few reasons. You got some hints from Vicki's presentation. A lot of people mistakenly think that if a little disinfectant is good, then more is better. And that's not necessarily the case. Using more, especially if you're not using it correctly, can not only not provide any additional benefit, but can actually put the health of you or your students at risk. Many of you actually probably have heard recent data from the CDC that poison center calls have been up in the last few months. So there's certainly an increase in short-term hazards and symptoms related to disinfectant and cleaning use. But those actually don't capture long-term effects. And so I wanted to just share with you some of the science about long-term effects. So we don't really have data about people who are exposed long-term to a single chemical, just because that's not sort of the general practice, right? People who do cleaning work tend to be exposed to multiple things. So what we can do is look at that data from people who do cleaning work. And what we find is that people who do cleaning work, and the reason I'm phrasing it that way is that includes not just people who identify as being employed as cleaners, for example, but also, you know, if you have teachers who are having to do cleaning work as part of their job, nurses often have to do cleaning work as part of their job. Anybody whose work includes cleaning, those folks tend to have the highest rates of work-related asthma. And in fact, anybody whose job involves cleaning product exposure, and especially those people who have to prepare disinfectants, have an increased risk of asthma. If you look at data from people who are doing cleaning at their own homes, people who use bleach or people who report using multiple different kinds of sprays, either cleaning or disinfecting products, those folks tend to have higher rates of what we'd call lower respiratory symptoms, so cough, wheeze, those sorts of things. A lot of cleaning products release what are called volatile organic compounds, often abbreviated VOCs, and children whose homes have higher levels of VOCs are more likely to have asthma. Again, you know, still thinking about the lungs, more of a chance of what we would call subclinical airways inflammation, so irritation in the lungs that doesn't necessarily show up as symptoms that someone would notice right away, but that if we do testing, we do sort of clinical testing, we can see evidence of that inflammation, the sort of thing that could contribute to asthma or other illnesses down the road. And then there was a recent study out of Canada, actually, that children who have been exposed to more cleaning products as infants are more likely to wheeze when they're older. And I'm sure many of you who are involved in schools and in different capacities are aware of just how common asthma is in our kids these days. And so this is certainly, you know, both the fact that cleaning and disinfecting products can contribute to the development of asthma and the fact that they can make asthma symptoms worse for someone that already has asthma is really a problem and is something that we should be keeping in mind. All right, so having done a little bit of that background about, you know, why we should be worried about disinfectant use, let's talk about a couple of the most common classes of disinfectants. So we'll start with bleach. It's the most commonly used disinfectant. I'm sure many, if not all of you, have used it at some point in your life. Bleach is thought to kill microorganisms by clumping together the proteins. That's what we call protein aggregation. Sort of clumps things together and breaks the cells up that way. Vicki mentioned earlier the importance of dwell time. That's the idea that when you're using a disinfectant, in order for it to work properly, it needs to stay sparkling wet on a surface for whatever that dwell time is. So for example, standard household bleach, the dwell time for most of those products is 5 to 10 minutes. So if your bleach bottle lists a dwell time of 10 minutes, that means that you should have first cleaned the surface, right? Remember Vicki talked about that bleach is inactivated if there's any dirt present. So clean the surface first. Then you need to have the bleach sparkling wet for a full 10 minutes in order for it to have disinfected. That means that if it dries in the meantime, that you need to reapply so that the surface can stay wet. And it needs to stay wet that entire 10 minutes in order for it to have acted as a disinfectant. Many people are aware that if you have really big exposures to bleach, you can have respiratory symptoms, right? It might make you cough or sneeze or have trouble breathing. But it's really important to know that when bleach is mixed with other chemicals, it can make some particularly toxic gases. So for example, bleach and ammonia products mixed together can create a toxic gas called chloramine. Bleach mixed with any acid, and that includes really common acids that people don't think about, like vinegar. If you mix bleach and vinegar, it can create chlorine gas. Chlorine gas, if you remember, was a chemical weapon used in World War I. So this is really serious chemistry that I think it's easy to forget about because things like bleach and vinegar are such common products. Bleach has been specifically designated as an asthmagen. So this means that with chronic low-level exposure, it's associated with asthma development. That's in both animal studies and in cleaning workers, like we talked about a minute ago. And I mentioned briefly that there's been this real increase in poison center calls since the start of the COVID pandemic. And bleach use has actually been responsible for the majority of the increase in those calls. You know, people are nervous and really ramping up their use of various products and not always remembering to do so safely. You should always be reading the label for what the safest, you know, what the dwell time is, but also what sort of protective equipment you should be using for any product. All right, and then the next common category that I wanted to talk about is what are called quaternary ammonium compounds. These are often abbreviated as either quox or quats. You can recognize these because they'll have a long chemical name with ammonia somewhere in it. So if you look on the back of a package, it'll be like 2,3 ammonia 6,4 . These tend to be really long. Up until a few years ago, when the various companies began branching out a little bit, almost all of the disinfectant wipe products on the market were quaternary ammonia compounds. So if you think right now of some common wipe brand names that you've known of for years, those are probably quats. These are cationic detergents, so they're positively charged. They're thought to work in a couple of ways. So they break up the cell membrane, the sort of outer casing of the cell, and there's some question about whether they might have some intracellular effects as well, might act on some of the genetic material, though that's less well understood. These have common dwell times that are often a teensy bit shorter than bleach, although similar range, 4 to 10 minute dwell time range. And an important thing to know about these is that ammonia is released during cleaning. And so particularly if you're cleaning a small space, there was a study of cleaning workers cleaning bathrooms. The amount of ammonia in the air can really build up quite quickly. These are also known asthmagens. Again, that means that with chronic low-level exposure, people can develop asthma. These actually have what we'd call a higher odds ratio after exposure than bleach. So the idea there is that if you're exposed to the same amount of bleach and a quaternary ammonia compound, you're actually even more likely to develop asthma after exposure to the quaternary ammonia compound. There is some evidence of mutagenicity, so that means changes to the DNA, and potential reproductive toxicity in animal studies. I mention this just because it's sort of a newer thing. We don't have a lot of information in humans yet, but it's enough for us to be concerned. As Vicki said, a lot of the people who work in both schools and in childcare settings are women of reproductive age. And so when you have products that have potential reproductive toxicity, that's a concern, and it's something we should all be aware of. So, even though it's not proven yet, it's something we should be cautious about. And I mentioned before that chloramine gas can be released if quaternary ammonium compounds are mixed with bleach. All right, so the best thing to do, as I mentioned, is to clean everywhere, disinfect only those surfaces that you need to, and when you're cleaning and disinfecting, to be using the safest products possible. Slide. Vicki already showed you these three, but I'll just reiterate. that Green Seal and Ecologo and Safer Choice are all different, different groups that certify cleaning products as safer for human health and the environment. They're not necessarily equal. They're sort of different in the ways that they regulate things, but they're all, you know, good choices as a start. I think one thing to just, again, know your local regulations. Sometimes certain local regulations will allow products off of one, sort of off of one list or another. So you should know what your local requirements are. Next slide. And then Vicki mentioned the EPA Design for the Environment Antimicrobial pilot project. This is the only group that's able to make recommendations for safer disinfectants, and that's because it's through the EPA. The EPA is who registers disinfectant products. Disinfectant products actually fall under the bigger umbrella of pesticides, and so those have to be regulated by the EPA. And because of that, they're the only ones that can make specific recommendations. They have this list that they've put together of active ingredients in disinfectant products that are safer for both human health and the environment. They also then have a list of specific products that they've reviewed, not only the active ingredients, but also all of the inactive ingredients. So, you know, as Vicki said, it's sometimes hard as a consumer to be able to tell what the entire list of ingredients for a product is. But in order to be on the Design for the Environment list, the manufacturers had to submit that entire list to the EPA for review. And so this is a good way to know that things are safer. I will call out really quick just for folks to know, as I've given this presentation a few times recently, I've gotten some questions about peroxyacetic acid, which is second from the bottom there in that list of active ingredients. If you mix hydrogen peroxide and peroxyacetic acid together, that is also an asthmagen. So products that have both of those ingredients, I would also avoid. It's a little bit of a tricky thing because individually, those are not asthmagens, but mixed together, peroxyacetic acid and hydrogen peroxide can be problematic, thought to mostly be the peroxyacetic acid component. If you flip to the next slide, I'll show you within the current pandemic, many of you probably know that the EPA released the N list, which is products that they expect to be effective against SARS-CoV-2. This doesn't actually mean that those products were tested on the SARS-CoV-2 virus, but that they've been tested on what are often referred to as indicator organisms, things that are similar to the SARS-CoV-2 virus. We expect to behave similarly. We know that these products work against those similar organisms. Within the N list, you can look by active ingredient. So the N list, as they initially published it, shows up on the left, and that's still available on their webpage. You can see that the second column there has active ingredients. So one thing that you can do is take that list of active ingredients for Design for the Environment and look for a product on the N list that has those active ingredients. More recently, I think it was about a month ago now, EPA made this list N tool that allows you to sort. And so if you pop open that list N tool, you can actually click on that second button for active ingredient and you could pick. So for example, I often use hydrogen peroxide products at home, and so I can click there, click on hydrogen peroxide, and it'll show me the list N products, meaning the products that they expect to be effective against SARS-CoV-2 that use hydrogen peroxide as an active ingredient, because I know that that's a safer active ingredient. Slide. Here's my references. I will just say one more time, Vicki mentioned that we have a resource that we put together at the Western States PASU. It's listed in the resources from this webinar. That's a sort of one-page fact sheet on cleaning and disinfecting during the COVID pandemic. It's really targeted at home sort of use, thinking about how people are cleaning and disinfecting their home. And Hannah, you can go ahead and get the next person all set up, or Karen, you can share yours. But the principles are still the same. And so certainly, you know, if you wanted to be able to help explain to folks the approach of being sure to clean everything, disinfect only the surfaces that you need to disinfect in order to minimize the toxicity while you're maximizing the benefit, you can certainly take a look at that. and would expect it to be useful for you. What it does not include, as I mentioned, there's just such a wide variety of regulations around the country. So you do need to be sure that you know what your local regulations are.
Great, thank you so much, Dr. Holm, for your presentation and all of your clear information that you provided for us. We're going to move on now to Dr. Wang, Director of CHE.
Great, thank you so much. I'm just pulling up our website, Because Health. So CHE also has a public education campaign primarily dealing with environmental health issues called Because Health. It's our main audience is millennials, of which many are young parents or who work in early child education or in schools. So we put together on our website, we have an area for just COVID-19 resources, and we've put together something that parents can easily send to their care providers or schools. And here it is. You can download the PDF here. And we talk about many of the same things that were talked about today during the webinar. What are some common concerns with disinfectants? When to clean, when to disinfect, what are safer disinfectants? What are some ways to limit the need to disinfect in other ways? And, we go into some detail on how long the COVID-19 virus has been shown to survive on surfaces, some ideas about what to do with supplies, toys, books, best recommendations on increasing ventilation, and we have sources and resources if people would like to know more. We also have on here one page about why choosing safer disinfectants and cleaners is important, that parents can download an email and send to their schools, both about green cleaning and about safer disinfectant use. And then lastly, another one-page sheet about hand washing and hand sanitizer. We had an earlier webinar about safer cleaning and disinfectant use during coronavirus at home, and we just put all of that in a similar PDF, similar looking, and this is really geared towards what people can do at home. So we talk about some of the same concerns, when to clean, when to disinfect. We get a lot of questions about deliveries and packages, so we put some information there. Hand washing and hand sanitizer again, and then we get a lot of questions about DIY cleaners and disinfectants, and we talk about safety and recommendations there. So I just wanted to highlight this as a resource that is, we're just taking all of the best recommendations and put them in a nice place for people to download and send. So I think with that, we're gonna start getting into our questions because we have a lot. So let's start. First, Vicki, we had some questions for you, specifically about rugs and carpets. What do people do? We can't always remove them. How should we clean them? Should we disinfect them?
Well, it's very difficult to disinfect textiles, I should say that. One thing I didn't talk about, which isn't actually an effective way to disinfect textiles, is there are these dry steam vapor machines that you can use. They're expensive is the problem with them, but they're extremely effective at cleaning and disinfecting both hard surfaces and textiles.
And to be Vicki, you're talking about steam cleaners that use just water vapor, right? Not any other sort of disinfectant product.
And I can add to the resources that Che will post some information on those devices. The problem in childcare with those devices is that they're technically, the EPA registers these devices, but they're not in the same category as a disinfectant, which are, they're chemicals. And this is not a chemical, it's just dry steam. But they really do clean surfaces beautifully, and they kill everything in seconds. But as I said, they're expensive. There are some disinfectants on the list, EPA's list N, that are appropriate for textiles. I don't know how well they work, and I'm not sure what the chemical content is of them. And I certainly wouldn't use something that's not on the EPA's safer disinfectant active ingredient list on a rug where children are rolling around on the floor. I mean, one problem with any disinfectant is it leaves residue. And on textiles like rugs, you can't rinse the disinfectant off. It dries, and then it flakes off in the dust, and kids are then putting it on their hands and in their mouths. So rugs are a problem from that point of view. I saw there's a question about non-removable rugs like wall-to-wall carpeting. And for those rugs, really the only thing you can do is to have someone come in and deep steam clean them, with a machine. And that's covered in the green cleaning toolkit.
But so I think one thing to remember is that if you've got a rug like that you can't, you're unable to disinfect, that hand hygiene again becomes increasingly important, right? It's a good reason to, if the kids are on the floor, make sure that we're hand washing afterwards.
I mean, the other thing too is that the virus doesn't live very long on textiles. It lives on hard surfaces.
Yes. Okay, we had a couple questions about microfiber cloths. Why are they recommended for cleaning and disinfecting? And how do you clean them after using them?
Well, you need to have, a washing machine available to you to clean them. There's a fact sheet in the green cleaning toolkit. It's called Why Microfiber, that describes the physical makeup. They're extremely small fibers, smaller than a human hair. And they have a charge to them that attracts dirt and germs. They're also able to absorb many times their weight of liquids. But it's mainly the charge and the very small fiber. So when you look at microscopic pictures of cotton, what cotton does basically is push the dirt around on the surface, but microfiber sucks it up. But when you launder it, you do have to launder it. You have to launder them separately from cotton, because if you launder them with any kind of cotton fibers, the cotton fibers will get in and gum up the microfiber. So you wash them separately in hot water. Do not use fabric softener, because that too will gum up the fibers.
Okay, great. We had a couple of questions about bleach. Maybe Stephanie, you can answer because you talked about them. Using bleach and water as a disinfectant is still a 5 to 10 minute dwell time on hard surfaces. And does it matter how much bleach you use? Is it still always 5 to 10 minutes? And another one that said, I have heard that bleach and water can be used on door handles. Please address bleach solutions and safety on these types of surfaces as well.
Great question. So you should always be looking at the back of your bleach bottle to see how it recommends diluting it. Different bleach products come with different strengths to begin with. And so some of them will say that it's intended to be used straight out of the bottle. Some will say it's intended to be diluted, and it'll do a dilution recipe. So you should always follow the instructions. And different bleach products have different dwell times. So, I say 5 to 10 minutes as a general, but you should actually look at the product label and see what it says. But I would say that as a bigger sort of principle, I would avoid using bleach as your disinfectant for doorknobs if you can pick something else. So find a hydrogen peroxide disinfectant, for example. Use that for your high touch surfaces. That should work just as well and have less toxicity, less side effects for you and for the kids.
The other thing that's important about bleach is that you have to make sure that it's got an EPA registration number on it.
Okay, we have a question here about electrostatic sprayers to mist or fog disinfectants in classrooms and buses, hoping to kill the COVID-19 virus. The question, my understanding from EPA and CDC recommendations is that this is irritating to lungs. Can you please speak about electrostatic sprayers, and also just my addition, what types of disinfectants and chemicals are used in these sprayers?
Yeah, great question. So the short version is please don't do that. You know, these products that we're talking about for disinfection are for surfaces. When you're trying to deal with virus particles in the air, the best thing to do is to improve ventilation, right? So that's open windows, that's make sure you've got good airflow. Misting products into the air is really unlikely to have benefit and can definitely have respiratory harms. In terms of specifically what products are used, Karen, it's a variety depending on sort of who the specific manufacturer is. But there's really, you know, very little reason to expect that that would be helpful, and certainly still harms. So yeah, please discourage folks from trying to do any sort of misting of disinfectant products, thinking that that would be beneficial, because it's not. You're much better to improve ventilation.
Yeah, I had looked into this question a little bit. I think some people were interested in them because you can, you know, essentially cover every hard surface in an area, you know, quickly. But in my limited research, only quat-based disinfectants or bleach-based disinfectants were used in a lot of the commercially available electrostatic sprayers. So that would come with the health concerns that you discussed. Yeah.
Right.
We have
and you know, even though it seems like it might be more efficient to be able to cover lots of surfaces, if you're throwing extra product into the air by doing so, there's a real downside to doing that. So as I said, I really would not recommend that.
Yeah. We had a couple questions about thymol. It's a disinfectant that is used in both the 7th generation disinfectant spray. Could you talk a little bit about thymol?
So thymol is a cleaner. I actually don't believe that it's a disinfectant, but it can actually also be irritating for folks with asthma. So this is a good example of one of those things that's in a quote green product that can still have health effects. Yeah, I would encourage folks to instead focus on those safer ingredients that DFE, Design for the Environment, has listed.
Okay. We had another one looking at asking about hypochlorous acid, such as used in Force of Nature cleaner. You didn't mention that. Could you please talk about that? Sure.
Hypochlorous acid, hypochlorite are all sort of in the bleach family, actually. And so those are not safer. Those should not be chosen. You'd be better to choose one of the safer active ingredients. And, you know, as we were talking about with bleach a minute ago, you want to make sure that anything that you're using has an EPA registration number, so that you know that it's a EPA registered disinfectant. You should also always check the expiration dates. Bleach is often relatively short-lived, and you should know when that expiration is. But yeah, hypochlorous acid, hypochlorite, those all have very similar toxicity profiles as bleach.
I will also note that it is listed on the list N, but the contact time is 10 minutes. So it's also can be kind of difficult to use safely. Can someone talk about alcohol-based hand sanitizers and use on students and babies?
Really quick before we do that, I just wanted to say, I hadn't mentioned this, but off of what you just said, Karen, on that list N tool, you can also search by contact time. So if you know that you're going to be having to disinfect a lot and you want something with a short contact time, you can search for a product that is, for example, hydrogen peroxide with a less than 2-minute contact time. So that's definitely a possibility to make things easier for you. The question about hand sanitizer use. Yeah, so, you know, hand washing is actually more effective in general than hand sanitizer. And part of the reason for that is that If you have any amount of soil on your hands, whether that's literal soil like dirt from playing outside, or just any sort of grime or whatever, hand sanitizer just sort of mixes that around, right? Whereas if you're hand washing with soap and water, there's some mechanical removal. And especially when you're thinking about little kids, right? If I've been playing in a sandbox or I've been digging in the dirt with my friends, you could well have a fair amount of stuff on your hands that really needs to be mechanically washed off. So hand washing is better when that's available. Certainly, you know, in a classroom, if you've got a sink, you'd be best to just make it part of the classroom routine that as kids come in, they line up at the sink and they wash their hands. That being said, from a safety perspective, it is safe to use hand sanitizer on even small children. The amount of absorption is relatively small. It's not something you need to worry about. One thing to be concerned about is to be careful about ingestion. That's true with actually really any chemical that you have in a classroom, right? You want to be careful about any cleaning or disinfecting products, that you're being sure to keep those where kids can't access them. And hand sanitizer as well, you want to be sure that there's not a risk for ingestion. But even down to toddlers, it's okay to use hand sanitizer. You don't want to be using these in infants because you want to try and minimize the use on someone who might still be repeatedly sticking their hands in their mouth.
Okay. Actually, there was another question. It could be for either of you guys. They have not found a product that is EPA approved on list N to be used for mouthed toys or in kitchens. Do you have a suggestion?
Well, that would be a sanitizer, not a disinfectant. I mean, that's the definition of food contact and mouth things, is that they don't get disinfected, they get sanitized. I would, for toys, I would stick, if it's possible, I would stick them in the dishwasher. That's a good way to solve that problem.
Yeah, so I think as Vicki said, list N was really created as a list of disinfectants. But if you're looking for something that can be used on food contact surfaces and on mouthed objects, what you're looking for is a sanitizer, not a disinfectant. I think one thing that's important to remember, we are of course all particularly anxious about SARS-CoV-2 right now, as you would expect. And you know, there are plenty of good reasons for that. But from a microorganism standpoint, it is not a particularly difficult to kill virus. It's not a particularly unique virus from a cleaning, disinfecting standpoint. And so sanitizers that you know, would be recommended for schools or childcare under other circumstances to help protect you and your students from all of the plethora of things that go around in any usual school year, influenza, all that kind of stuff, you would expect should also be effective for SARS-CoV-2.
Okay. Someone asked about VOCs. Could you please explain what are some examples and what are the health effects?
Yeah, sure. So VOCs, it stands for volatile organic compounds. So those are any sort of chemical that is released off of a product. I mentioned that cleaning and disinfecting products release those commonly, but so do a lot of others. Common VOCs that you might have heard of are things like formaldehyde or benzene. Those can cause respiratory effects, so similar sorts of like asthma and breathing problems. Some of them are also cancer causing. So formaldehyde and benzene with long-term exposure, there's evidence for development of cancer. I think that's sort of a good brief primer on VOCs.
Okay, great. We have one question. There are only a few designed for the environment products and they are not available right now given demand. If you only use the active ingredients to search for, couldn't some of them then also include other active ingredients like quats or other toxic chemicals as inactive ingredients? How can you know, or what should you do if you can't get designed for environment products?
Great question. So products have to list all of the active ingredients. So it should not be possible. I try to never say never, but it should not be possible for there to be a product that has a quat also in it and not disclosed. But what there could be is other inactive ingredients like fragrances, like other compounds that are not actually part of the disinfecting process, but that can have human health effects. So you're right. In an ideal world, there would be an infinite supply of design for the environment products that we would all have access to. If you do not have access to it, which many of us don't right now, then the safest thing to do is to pick something with an active ingredient on the DFE list, even if you can't know that all of the inactive ingredients are as safe.
Okay.
There are products, actual products, also listed on the DFE website where they talk about the approved active ingredients. So if you scroll down, there's a whole long list of products that you can look up.
Absolutely, and you may be surprised. I actually managed to find some at my local big box store last weekend. But certainly supply chains are disrupted around the country, and you may be in a position where you can't access any of those.
Stephanie, you mentioned hydrogen peroxide. Could you talk about the dwell time for hydrogen peroxide?
Sure. Again, you should always read the label, but there are some peroxide products with dwell times as short as 1 minute, which, you know, I will say I tend to use hydrogen peroxide-based products in my own home for high-touch surfaces. And it's partially because of that I find it much easier to use a product that has a 1 minute dwell time than a 5 or a 10. But you should always read the product label. It's different for different products.
And how about UV disinfection? Can you talk about those devices?
So great question. I actually don't know as much about those devices. I don't know if Vicki wants to chip in here. I think one of the things that's tough about devices in general is that many of the regulations specify chemical disinfection. And so for a lot of places, if you look at your local regulations, it's going to say that you need to use a chemical disinfectant. And so those devices wouldn't be allowed under that. But that's not an area that I know as well. I don't know if Vicki has anything to add.
I'm not familiar with them. I think with kids present, it's probably not a very practical solution.
Yeah, okay. What level PPE should cleaners use?
It's a great question. And this is, again, one of those things that depends on what product you're using. So some products will recommend the use of gloves. If you're going to use gloves, you want to make sure that these are good, you know, sort of your grandma's thick rubber gloves, not just like disposable, you know, the kinds of gloves you see people wear in healthcare settings. You need kind of thick rubber gloves to protect yourself. Some products will recommend using respiratory protection, like an N95 mask. So you really need to look at what the product recommends. Yeah, Vicki?
Yeah, you know, the Green Cleaning Toolkit has a whole section in it about if your childcare program doesn't have a worker protection program where you know what the hazardous chemicals are that you're using and you've been trained in how to protect yourself from them and you know where the safety data sheets are, then you need to insist that that kind of program be established in your school or center. And those safety data sheets, which you should have access to, will list the personal protective equipment that each product that you're using requires. And that's, you know, that's your right as a worker to have access to that information.
Okay, great. We had another question about carpets and rugs. Can you spray alcohol, rubbing alcohol on carpets and rugs?
You would have to use a pretty large amount of alcohol to really make an effect. It just doesn't seem very practical to me. I mean, the cost would be, you know, over time would be quite enormous.
Yeah. We had someone ask about silver infused cloths, other silver or other metal infused things. Have you guys heard about those and any recommendations?
I haven't.
I haven't either.
Okay. Regarding, let's see, someone asked about vinegar. is there a concentration of vinegar that is enough to kill the virus? Are there any studies on this? Can you answer that question?
So I actually discourage people using vinegar as a widespread cleaning product because it is also an asthmagen. It can also both cause asthma and be irritating to folks with asthma. So I would instead, for a cleaning product, focus on a basic soap and water or a basic detergent. It's also really important, someone just reminded us in the comments that we hadn't said this aloud, but as much as you can, use fragrance-free products. Choosing products that don't have added fragrances is also really helpful for people with respiratory diseases.
Okay, we had somebody ask about ventilation. Is there a recommendation? I will say that we have a little bit of that on our fact sheet, and we refer people to, it's ashrae.org. It's the American Society of Heating and Air Conditioning Engineers, and they have a very great page on ventilation and best practices and what the research is.
Yeah, ASHRAE is who sets the standards for things, so they certainly have good information. The EPA also has an indoor air toolkit for schools that is not specific to COVID. It's been around for a long time. But actually, if you look at the data on ventilation in schools, I've been working on another project where this is relevant, most schools do not meet basic ventilatory requirements. So, I think this is, as Vicki was saying earlier, using the pandemic as a opportune moment to just increase our health and safety protocols in general, using that to get all of the schools up to sort of basic ventilation requirements would be a good way to minimize spread of virus as well by encouraging airflow. So I definitely look at that. It's a nice toolkit specifically for schools.
This isn't related so much to SARS-CoV-2, but we're also experiencing a lot of wildfires, and looking at the MERV ratings of the filters that you're using in your HVAC system is also important. MERV 13 will help reduce some of these particles.
Yeah, great. Someone asked about the dwell time for rubbing alcohol. Do you guys know?
Don't know.
I think that generally, I think it depends on the concentration, but I think that for 70% concentrations, the dwell time is 1 minute. So it's also quite short.
But again, just read your product label because, everything depends on concentration and makeup.
Let's see. I think that, we've covered most. Oh, someone asked about, we didn't really have time to get into hand sanitizer today, but could one of you speak to the recalled hand sanitizers with the presence of methanol? Are there any formal guidance or websites that can be shared for schools about these types of hand sanitizers and what ingredients should be in hand sanitizer?
Sure. This isn't my area of expertise, so I don't have a great succinct resource to point you to, but I would say that in general, keeping abreast of recalls is certainly a good plan. Methanol is, as folks probably know, is a toxicant and certainly should not be in hand sanitizers.
It should be isopropyl alcohol.
Correct.
That's what should be in the alcohol-based sanitizers, is isopropyl alcohol.
Yeah, and it should be at least 60%. Okay, I think we had a couple questions about, the green cleaning toolkit, Vicki, that you mentioned, and the Appendix K that you showed. These predate the pandemic. Is a review and revision in order, or can we, basically if someone downloads these documents, is any of it applicable in today's current situation?
Well, both things talk about how if there's increased illness in your facilities, that you should increase your high touch area cleaning and disinfection. And I don't think it's any different for SARS-CoV-2. If you've got high touch areas, then you should be increasing your cleaning and in certain of them disinfection.
Yeah, from a cleaning and disinfecting standpoint, as I said earlier, this virus is very similar to a lot of other viruses that go around, you know, during winter seasons. And so, you know, all of the recommendations that apply for keeping kids safe from other coronaviruses and rhinoviruses and influenza viruses and all of the other things that go around really apply here as well.
Okay. I think that those are all the questions that we have. And we've gone over a little bit. So Hannah, I'll give it back to you.
Great, thank you so much, Karen, and Dr. Holm and Dr. Leonard too, for all of your time. We're approaching the end of today's webinar. A video recording will be available on CHE's website soon, and tomorrow you'll receive an email containing a link to the video. The next CHE Heats Partnership webinar is our second in the series, Young UDC Scientists Showcase. It will take place tomorrow, July 1st, and is titled Endocrine Disrupting Chemicals and Metabolic Disruption. To learn more and RSVP, please visit our website at healthandenvironment.org. If you are new to CHE and would like to stay updated about upcoming events or more, please sign up to receive our newsletter by selecting the Join Us tab at the top of any page on our website at healthandenvironment.org. Additionally, if you appreciate these CHE partnership webinars bringing you the latest environmental health research for free, we encourage you to support CHE's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank our speakers, Dr. Leonard, Dr. Holm, and Dr. Wang for taking time to present today. Thank you for your excellent moderation, Karen, and thank you so much for joining us. Have a great day, stay well and healthy.